Hello friends, I have the pleasure of welcoming you all to my YouTube channel Dr.Manoj Kishore Homeopathy. Friends, as I promised you, I'll be sharing and uploading few small videos regarding various medical conditions and that will eventually help you people to understand, to diagnose and to treat your patients accordingly. So let's begin with our first video, and the first topic of discussion would be a very authentic, very common, and I must not hesitate to say that this is considered as a multi-headed monster. Friends, I am talking about the allergies. Now see, what is allergy? What exactly we mean by allergy? Allergies are those conditions when your body's immune system responds or reacts to any foreign invader. Now these invaders can be a bee sting, can be the pollen, can be dust, can be mites, can be some chemicals, etc. etc. Now your body has got this capacity of producing antibodies against these antigens or the foreign invaders. Now, before we begin our discussion about allergies, we must not forget that a substance which may be an allergen or may be considered or may be treated as an allergen for one individual, that can be even a friend or a non-harmful agent for others. So we need to understand these finer aspects of allergy or allergic reactions. Now you see, the severity of allergies varies from person to person. It can even produce some irritation in your skin, or in some individuals it can produce or it can lead to anaphylaxis. Now we need to understand what is anaphylaxis. Anaphylaxis is a very acute emergency or acute medical emergency, may be considered as acute medical emergency, which requires immediate hospitalization. And this anaphylaxis is nothing but an hypersensitive reaction of an individual to any particular drug substance, for example penicillin. Now I think after this introduction or after this introductory part, we can move on to discuss about various types of allergies. So friends, let's begin with the particulars or particular agents that can cause allergy. Allergic symptoms or allergic reactions depends on the type of allergens and also the area they involve. It means they can involve the airways, they can involve the sinuses, they can involve the nasal passages and skin and the digestive system. Now, allergic reactions can range from a mild to severe states. In some severe conditions, as I told you, can cause anaphylaxis, and that may require some immediate medical attention, or you may at times have to refer the patient to some super specialty hospitals. Means you should not or you cannot keep them with yourself in your private practice. Now let me begin with the first type or the very common condition, allergic reaction. Suppose let's talk about hay fever. Hay fever means you can say it is allergic rhinitis. Now this may cause sneezing, this may cause itching of the nose, this may cause eyes or roof of the mouth to itch, runny and stuffy nose, and watery red and swollen eyes, which we all commonly know as conjunctivitis. Now a person can have food allergy. See, when we are talking about food allergy, it is very relevant in present condition. Every parent or any parent, they are really worried about their child. We all are, because these food allergies are very often suffered by none other than the kids or the children. So their parents are usually very much affected or worried about these conditions. So food allergy is nothing but various types of foods that can cause allergic reaction, and the most common would be, I should say, egg. Egg allergy is very common. Now if you think of food allergy, the food allergy can produce tingling in the mouth, swelling of the lips and tongue, face or throat. There can be hives. Hives means it is like an arterial reaction, hives. And it also can produce anaphylaxis. There may be, as I told you, a very common contributing factor for allergic reactions is bee stings. So an insect sting may cause an allergic reaction, which is quite common. Means we all have suffered from these type of conditions once in our lifetime, or are frequently suffering from these kind of conditions. So a large area of swelling can be there if a bee sting is producing that allergy reaction. Large area of swelling, or that there can be edematous condition of that particular area at the site of sting. Itching and hives all over the body. Itching and hives. Hives, I told you, the arterial-like growths. Cough may be there. Chest tightness, wheezing or shortness of breath can be also there, and there may be anaphylaxis. So a person can also have allergy from drugs, that is called drug allergy. So the drug allergy may cause hives, itchy skin, rash, facial swelling, wheezing and anaphylaxis. There can be atopic dermatitis. Atopic dermatitis is quite common, and this is also an allergic skin condition that is also called as eczema, or may cause skin to itch, for redness and flax, or to peel. Now I'll be talking about anaphylaxis in particular. Some types of allergies that include allergies to food and to insect stings have the potential to trigger a severe reaction known as anaphylaxis. As I told you in my earlier statements, anaphylaxis is nothing but an hypersensitive reaction of our body, of an individual, to any particular drug substance, for example penicillin, or it can be a bee sting, or it can be any particular drug that cause severe reaction in our body. Now why this anaphylaxis becomes so important to discuss again and again? If you study shock, or if you study the types of shock, this anaphylaxis at times lead to a typical shock that is known as anaphylactic shock, or the shock that is caused due to the hypersensitive reaction of any drug substance. What the patient presents with. Now in an anaphylaxis, the patient can have loss of consciousness, a drop of blood pressure, severe shortness of breath, skin rash, lightness, rapid weak pulse, and nausea and vomiting. So these are the red line symptoms or the clinical features of any person who is having anaphylaxis. Now when you need to see a doctor, this is very vital, because once there is anaphylaxis, you immediately need to rush to a doctor for medical help. Now you might see a doctor if you have symptoms you think may be caused by an allergy, especially if you notice sometimes that it seems to trigger your allergies, or if you have symptoms after starting a new medication. Suppose you have taken a drug without consulting your family doctor, and that has resulted in some kind of rashes, fever or irritability, then you should definitely rush to your family physician for help. For any severe allergic reaction, or again I am saying for anaphylaxis, you should always consult a medical emergency center. They are the best person to take care of you. Let us now discuss about the details of causes or the etiological factors or the allergens that can produce any allergic reaction. Now, the causes, it can be an airborne allergen, for example, pollens, animal dander, dust mites, and the mold. It can be certain food particles, particularly peanuts, tree nuts, wheat, soya fish, shellfish, eggs, and milk. It can be some insect stings, such as bee stings or wasp stings. It can be some medications, such as penicillin or penicillin-based substances or antibiotics. Latex or other substances also have the capacity or have the tendency to produce allergy-like reactions, which can cause allergic reactions in the skin. Now, what are the risk factors? We must remember what are the risk factors. When somebody has got a family history of asthma or allergies, you are at an increased risk of suffering from allergies if any family member, any close relative is having asthma, or you yourself are suffering from asthma or are having some allergic reactions to any particular allergens. If you are a child, see, the sad part of this allergy is that any child or every child can suffer from some kind of allergy. Now, children are more likely to develop allergy than adults. It's quite obvious. Children sometimes outgrow allergic conditions as they grow older. However, it is not uncommon for allergies to go away and then come back in some time later. This is the peculiar tendency in some cases, in some individuals. Now, somebody is having asthma, as I told you, or have allergy conditions, are more prone or are increasingly susceptible to suffer from allergic reactions. Now, what can be the complications? Once you suffer from allergies, what can be the complications? As I told you many times, number one complication would be anaphylaxis, when you need medical emergency services. Second can be the asthma. A person can develop allergic asthma. Third, there can be atopic dermatitis. It is quite similar to that of eczema. There can be sinusitis or infectious conditions of ear or lungs. And sometimes the fungal complications of your sinuses, of your lungs. That is very, very important to remember. Now, when you need to prepare yourself for an appointment with the doctor, when you are preparing yourself to attend or to see a doctor, what you need to do? The first thing you need to do is write down your symptoms, including any of that may seem unrelated to allergy, including any of that you may think is unrelated to allergies. Write down your family history of allergy and asthma, very, very vital. Write down the list of medication you have already consumed or you already are taking right now. Ask the doctor whether you should stop any medications before your appointment. These 4 points quite important, are very important for you to do yourself. If at all you are thinking of visiting or seeking appointment of any doctor, please do not forget to ask your doctor whether to stop the medications you are already taking right now before his appointment. Now, I'm sorry. Now, what you can expect from the doctor? This is also quite important. Now, your doctor is likely to ask you so many questions, including what are your symptoms, when did your symptoms begin, have you recently had cold or other respiratory reactions, are your symptoms are worse at certain times of the day? Does anything seems to improve or worsen with your symptoms? Are your symptoms worse in certain areas of your house or at work? Do you have pets, or do you have to go to, or do they go to your bedrooms? Is there any dampness or water damage in your home or workplace? Do you have a family history of allergies or asthma? Do you smoke, or you are exposed to secondhand smoke or other pollutants on daily basis? What treatment have you tried so far and had they helped you? Do you have any other health problem? What medications, including herbal remedies, are you taking right now? Now, what test or investigative measures you need to do, or you need to go for any diagnostic measure for your confirmed diagnosis. To evaluate whether you have got allergies, your doctor may ask you to detailed question about signs and symptoms, perform a physical examination, and have you kept a detailed history of a diary of your symptoms or possible triggers. Now, in allergic conditions, this is very, very vital, or this may actually help you to diagnose your case quite easily, or it may also help you in your management. Suppose you keep a record of your triggers, means what substance, what weather condition, what food particle, what pollens, or what are the circumstances that actually leads to aggravation of your allergic condition. If you have a record of it, that is definitely going to help your doctor. And as far as investigation is concerned, if you visit a doctor, he may advise you to go for a skin test. In skin test, what they do, they prick a part of skin, and that part is exposed to small amounts of proteins found in potential allergens. And if you are allergic to that particular agent or particular substance, you may have rashes on your body, or you may see hives production. Second is, they may go for a blood test. Now, this blood test is sometimes called RAST, or it is called radioallergen conservant test. This test helps you to find out, or it can measure your immune system's response to a specific allergen by measuring the amount of allergy causing antibodies in your bloodstream, known as immunoglobulin or IgE. So these are the two commonest investigations they do to find out the level of allergy or the kind of disease you are suffering from, especially the allergy. Now let's talk about the treatment and the drugs, or the lifestyle you need to lead in order to get rid of all these allergic reactions or allergic states. Now, if you visit your doctor, what they may suggest you: avoidance of allergic substances, your doctor will help you to take steps to identify what allergic triggers or what allergic substances you need to avoid as far as practicable. You have to take utmost care yourself to keep that in mind so that you may not suffer from any allergic reaction. Number one. Number two, there may be some medications to reduce your symptoms. Now, depending on your allergy, medications can also vary. Now, allergy medications can help to reduce your immune system reaction to ease the condition or to ease the symptoms. So, sometimes the medication can include over-the-counter or the prescriptions in the form of oral medications or nasal sprays or even eye drops. Now, the third is very important. It is called immunotherapy. Now, this is mainly adapted, or this kind of immunotherapy is opted or is suggested to the patients who are severely allergic, those who do not actually respond or improve on the conventional mode of treatment, or they do not improve by other ways of treatment. What they do, the treatment involves a series of injections of purified allergen extract, usually given over a period of a few years. And another form of immunotherapy may be, the doctor may advise you to go for sublingual tablets, means the tablets that are put under your tongue and that gets dissolved, and that usually are adopted for allergies due to pollens. The last but not the least, emergency epinephrine. If you have a severe allergy, your doctor may give you an emergency epinephrine shot to carry with you at all times. This is given for patients with severe allergy. Now, let me tell you a few things also about the lifestyle and the home remedies you should know to get rid of these conditions. Now, preventing allergic reaction depends on the type of allergy you have. General measures include the following: avoid known triggers, keep a diary, as I told you earlier also, keep a diary of allergens or triggering factors. Keep a note of it and discuss with your doctor. Wear a medical alert bracelet if possible. So these things, if you take care of, will definitely going to help you and will ease your symptoms of any allergic reactions.